Welcome everybody to this Atlantic regional meeting for the AVA project, which is the Alliance Against Violence and Adversity. I'm so pleased that you've chosen to join us today. My name is Cathy Holtmann. I'm the director of the Muriel McQueen Fergusson Center for Family Violence Research. And I'm delighted to introduce to you today the lead of the AVA project, Dr. Nicole Letourneau. Nicole used to be here at the University of New Brunswick and now is the director of not only the AVA project, but Resolve, which is the Western sister centers to the Alliance for Research Centers on Gender-Based Violence. And Nicole is at the University of Calgary. So welcome, Nicole, and over to you to explain to us an introduction to the AVA resources for all of our Atlantic partners.
Okay, great. Thanks so much, Cathy. Yeah, it is really nice to meet with you. I used to work in the same building I think you're sitting in, so kind of nice. Feels like it's coming full circle. All right, so just I guess Andrea is going to be driving my slides, so I appreciate that, Andrea. I really do. And I'm going to have my notes up on my screen too, so I hope I can stay synced with you nicely. But good morning, everyone, or good afternoon. Thanks so much for joining us today. I'm really excited to tell you all about AVA. We're doing a lot of really cool things that I hope you can take advantage of. And we are recording this session for those of you who are unable to attend, and hopefully be able to get access to the recording later if you wish, if you want to go back and look at some of the things that we talk about here today. And I also just want to point out that we're committed to offering AVA materials in both official languages. So the presentation today will be presented with French subtitles when it's ready for sharing. And as also regarding today's presentation, anytime you have any questions, you can just pop them in the chat, or you can wait till the end and we can talk about your questions and have a fulsome discussion at the end. So I'm just going to jump right in here. So the Alliance Against Violence and Adversity and the AVA Women's and Girls Health Hub are the two things we're going to be talking about today. And I see that we have moved right on into our land acknowledgement. So we have a national land acknowledgement that was recommended to us by our Indigenous champions on the AVA team. So on a national level, we encourage all Canadians and visitors to Canada to learn about the Indigenous people of our lands, the lands in which we live, work, and visit. And we also encourage everyone to become engaged allies together. And as Canadians, in the spirit of truth and reconciliation, we respect the self-determination of First Nations, Métis, and Inuit, and their rights and responsibilities in cultures, languages, and the pursuit of wellness. And the Alliance Against Violence and Adversity, or AVA, is located at the University of Calgary. That is the home of the Alliance, but we are a national alliance. But our home in Calgary is on the traditional territory of the Treaty 7 people, including the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda. And it's also the traditional home to Métis Districts 4 and 5. So we're really grateful to be able to work, live, and recreate in these beautiful lands. So go on to the next slide, which is just a little bio about me. And I guess I will just say a couple of things, but you'll have this in the slide deck if you're ever interested. But I am the scientific director and the principal applicant of the AVA project. And my research program outside of AVA is called the Child Health Implementation and Longitudinal Development Studies program that focuses on children's health in the context of parenting, attachment, and children's development, where we examine maternal depression, family violence, low income, and other risks, and how they can undermine or, if we address those risks, support children's health and development. And I'm also the director of Resolve, which Cathy alluded to. And I've been working on this stuff for over 20 years. And I'm a professor in the Faculty of Nursing at the University of Calgary, but also appointed in the Cummings School of Medicine and Pediatric Psychiatry and Community Health Sciences. I'm a member of a couple of institutes here. And yeah, been very fortunate to have been granted about $2.4 million for the AVA work, the Health Research Training Platform, and another $800,000 for the AVA Knowledge Mobilization Hub. So that's what I'm going to be talking to you about today. And you'll see one of our big ambitions and plans is to give out a lot of that money to help support community organizations across the country and students develop so that we can all work together to do community engaged implementation science research to improve the lives of girls, women, and gender diverse people. All right, so let's just go on to just a brief just so you know what I'll be talking about here. I'm going to give you an overview of AVA. I'm going to talk about how we're structured. I'm going to talk about the differences between the Health Research Training Platform, or the HRTP, and the Hub. I'm going to talk about our intended impacts of the Hub on the health of women and gender diverse people and girls, how the Alliance Centers are engaged across the country in this, and what we'll be hoping to do with our Atlantic partners on the call here today, and any next steps, and finally, just some links and so on to how you can access AVA resources. Okay, so just launching right in here. So AVA is a national health research training platform, but we are also, as I said, a women's and girls health hub. We receive 2 sources of funding from CIHR. But the mission of AVA is to create the capacity, or build upon the capacity, as it were, to transform community health and social services to promote health and wellness of girls, women, and gender diverse people who are affected by or at risk of violence and adversity. And we intend to do this in a collaborative, innovative, cross-sectoral, cross-disciplinary, cross-jurisdictional training platform. And are also, by doing that work, we're intending to reduce family violence and exposure to early childhood adversity. And we really want to improve Canada's UNICEF rankings for girls, particularly girls, and gender diverse people's health and wellness, with positive lifespan, intergenerational, and population impacts on women's health. As you may be aware, Canada's rankings for children's health, and particularly girls in Canada, are really quite abysmal. They've been on the decline for over a decade. I think at the latest statistics that compared Canada's girls to other girls and children around the world, ranked our children at 35 out of 37 or 38 nations on things like mental health, 30th on physical health, and terrible with terrible statistics around suicidality too. So there's some real challenges that are facing our children in Canada around mental health. And a big part of what we think is the problem is that where the things that can be happening to promote girls and families' health that actually could make a difference in improving mental health and physical health outcomes is in the community. And the community agencies that support these groups are just not given enough support. So that's what we're trying to do. And it's even gotten worse, and you probably are somewhat aware of this. I took a look at the Canadian Femicide Observatory data, and these data are publicly available. But while trying to address and preventing violence against girls, women has been a policy priority across Canada for more than 30 years, with all kinds of things tried to be done in the country. And one of the good things that's come out of that is the Alliance, of which Muriel McQueen Fergusson Centre is part and Resolve is part. Nonetheless, rates of domestic homicide have increased by 250% over the last 10 years. And today in Canada, every 1 to 2 days, a girl's or woman's life ends due to domestic violence. So we really need to do things differently. And that's, and we need to do a lot of things. And there are a lot of things happening across the country, and AVA is one part of that. Let's go on to the next slide. So just diving a little more deeply into what we're trying to do, what do we mean by transforming population, community, and health, social services, and so on to promote the health of girls and women? What we're trying to do is support community organizations and junior academics and more experienced academics to work together to reduce adverse childhood experiences, especially violence, which we think is contributing to those terrible UNICEF rankings. And obviously the terrible outcomes happening for girls and women in Canada right now. We want to promote life cycle and intergenerational health and wellness. We want to support families. We want to develop, deliver, test, and implement innovations across sectors. And by doing all those things, we're going to reduce the health, economic, and social costs of exposure to violence and adversity. Let's go on to the next slide. We are quite a large network. We are large and growing. We have right now over 200 partners across Canada and the US. And you can see we have a lot of partners in the Atlantic, all 4 provinces represented. And on this little graph, when it says A, it means academic, and C is community partner. So in the Atlantic region, we have 14 academic and 10 community partners. Community partners tend to be leaders that run organizations like domestic violence shelters, or shelters that serve low-income populations or equity-deserving populations. And these are really the, this is how we think that we can actually make a difference in the lives of girls, women, and gender diverse people who are at risk across the country by actually working to support those community organizations that serve them. So, we're only missing Yukon and Nunavut, and we're really definitely trying to find some partners there. But the sparse population makes it a challenge. But you can see in the more the larger population centers, we have lots of good and building partnerships. All right, so let's just move on to slide 9, which is our organizational governance chart. And I just thought this would be useful for people to see. We have a really distributed leadership team. And so I'm part of the core leadership team that's up there in the middle at the top. And so along with myself and a couple of early career researchers, Kara Ross and Ashley Stewart-Chefescu, were also co-led by a clinician who works in a women's health clinic at CUPS here in Calgary. And if you just go to the left where you see the Platform Advisory Committee, the executive director of that agency, CUPS, is the chair of our Platform Advisory Committee. And our Platform Advisory Committee is much like a governance board, and they oversee everything we do. While the core leadership team, a lot of people on this call are involved in the execution of what the operations of what we're trying to do here with AVA. Our Platform Advisory Committee is really an oversight board and includes the vice president's research of a couple of university or their delegates, lots of people with lived experience, and people engaged in all sorts of roles from academe to policy to as I said, people with lived experience and students. And then on the right here, you see that we also have a group that is comprised of people with lived experience, our Girls, Women's and Gender Diverse Engagement Committee, and they really review and give us guidance on all the stuff that we develop and provide. And before we actually implement things, they are our important group that makes sure that what we're talking about actually is relevant to the people that we're trying to help. So that's our leadership team. And then I think it's important to go to the left and look at those purple boxes along the side. And you can see Cathy's name listed there as one of the Alliance Center leads, because the Alliance Center leads are super important to this success, the success of anything that we do with AVA, in that the Alliance Center leads are our connections into the regions. They're the leaders in the regions, and AVA really does build on the momentum that the Alliance Centers have established over many years. We also have, I just wanted to just touch on what we've also done is identified champions for equity, diversity, and inclusion, for sex, gender-based analysis, for implementation science, and I think most importantly, Black and other racialized people, and the Indigenous knowledge champions. So our Indigenous knowledge champions are actually, as you'll learn more, are leading parallel Indigenous girls and women's health hubs that are parallel to what we're doing in the Women's and Girls Health Hub. And they have their own agenda that address research needs in their communities, but together with them, with the Indigenous knowledge champions and the work that we're doing in AVA, we all hope that we are going to be improving the lives of girls and gender diverse people affected by violence and adversity. Just the Indigenous group is taking their own approach to that work. And it's led by Marlene Bennett, who's the Canada Research Chair here at University of Calgary, an Indigenous scholar, and Malcolm King, who is the scientific director of an institute at the University of Saskatchewan, and also an Indigenous scholar. All right. And then you can see we have little sort of arrow shapes that are kind of in the middle. Those are our core groups that are taking on the major activities of AVA. So I'll talk more about that stuff, but you can see we have, for example, the Triadic Mentorship and Internship Committee, which oversees and makes sure that the AVA team members are executing on our strategy around Triadic Mentorship and Internship. So, but I'll talk more about those particular programs in a minute. Yeah, and I guess just maybe one last thing to comment on this slide is you see the little, almost looks like a flower on a smaller view, but it's meant to be like intersecting circles. But the Knowledge Mobilization Committee number 2 and the Strategy, Evidence, and Evaluation Committee number 5 are really being built upon a lot by the AVA Hub. All right, so let's go on to the next slide. All right, so this gives us, once we go on, there we go. So what does the AVA HRTP do? The AVA HRTP is designed to provide enhanced community engaged training to better enable the use of evidence-based interventions and innovations for the groups, the women and girls that we're trying to help. So training is explicitly for trainees in the traditional sense, graduate students, postdoctoral fellows, but also training for more senior researchers like myself. Like we have this principle in AVA, which is we all have something to learn. and we all have something to offer. So training, everyone is really considered to be a trainee. The other group that we're really trying to train is our community partners, so the leaders who are part of AVA that represent their organizations can share all the materials of AVA with everyone in their organization and really take advantage of all the resources, which I hope you'll be excited to learn about here in a minute. And then we're also trying, by doing this, maybe it's implied now, but because everyone's a trainee, we all have something to offer, and we all come from different places, we're hoping that AVA will really enable the breaking down of silos and barriers between the community agencies and academics and scholars. Scholars is the term we use in AVA to speak about the graduate students and postdoctoral fellows who are engaged in the AVA activities. And how we're trying to do this, on the purple box to the right, we're really trying to fill gaps in research trainings, particularly around implementation science, and doing this with our TRADIC mentorship program, and which includes a university academic like myself or Cathy, a community agency leader like an executive director or CEO, or a delegate in a community agency like Carleen Donnelly, who I mentioned before, and an AVA scholar, so a graduate student or postdoctoral fellow. And then we have these community agency internships, which are highly subscribed, and I think we've just implemented our first round of that beginning in January, and they're going very well. We're really excited about that. But these are paid internships to to scholars that work in community organizations. So community organizations are loving them because they get a highly qualified person doing something that's extremely relevant to the organization. In fact, that is the requirement. The project really has to meet the needs of the organization first, along with addressing the health of girls, women, and gender diverse people. And then we have AVA Online, which is an outstanding resource that you can access right now. There's an AVA Online curriculum with micro-credentialing, and you can even get course credit at Athabasca University for completing courses in AVA Online. And I urge you to check that out on our website. There are 4 streams, one to do with equity, diversity, and inclusion, another to do with the neuroscience of development, and another to do with implementation science. And the training there is really quite incredible. And we have been relying and building on the expertise of outstanding experts across the country as we build that curriculum. And then we have something called strategic planning and evaluation training and engagement. We've been doing that a lot in the first year, and we're actually moving toward wrapping that up. And our June 19th meeting, I think, will really be a concluding meeting for that. But we have been working with our community partners, these 200 or so on our team over the last 18 months to really build out our strategy and build out what we're doing based on the overarching ambitions. We have something else called the Early Career Research or Teaching Release Awards. So this is to enable those junior academics that just are in their first roles as assistant professors and tenure track positions to get opportunities to get released from teaching. We will pay out teaching responsibilities for new researchers so they can get engaged in the AVA activities. This is meant to promote sustainability of the program, and we've been having tremendous success with that. I think we've given out, well, it must be about 10 or so of those teaching releases so far to about 5 or 6 early career researchers at this point. So we renew them as well. So they don't necessarily have to be just like a 1-year thing. Once we get you in our fold, we like to keep you. So, and then finally, implementation science training. That happens through all kinds of activities, the mentorship, the internship, the online training, and so on. So let's go on to the next slide, slide 11. And if there's anything in the chat that I need to stop and speak to, someone let me know, because I can't quite see the chat the way I've got my screen set up. Thanks. So our plan is to address what we see as gaps in research training, and we're not the only ones to see it. It was certainly something that the CIHR that's funding us identified, and when they put out the call, that's what they wanted the teams to approach in the country. So we are trying to address gaps in collaborative implementation science research and understanding, which is a whole field unto itself. It takes a developed knowledge base to really know how to support the most effective implementation of programs, even those that are already being delivered. So we're doing a lot of work around that. We want to develop, test, implement, scale, and spread the best evidence that's going to promote the health of girls, women, and gender diverse people. And I guess working across barriers and silos, we've spoken about a lot, or I have spoken about a lot already. And as well as strategic planning, I've spoken about that. But all in all, through filling these gaps, we're trying to transform the way national capacity in these areas is built in the country. So let's go on to the next slide. So the next slide is a really core slide to what AVA is doing, and is also a slide that I think is available on our website. But you can see there's a lot of information here about the various programs. The Triadic Mentorship Program is number one. I spoke a bit about that already, but essentially, you know, it's called Triadic because everyone is part of the mentorship. Like, you know, when you have I'm mentoring a lot of people in this program, and I feel I learned a lot from the scholars, the graduate students, postdoctoral fellows that I work with, and equally from the community partners. So we all have something to gain, while our real target though is building the career of the scholar, that graduate student, and building upon the expertise, building that career based on the expertise of the community partner who's got tons of wisdom from expertise in the community, and the academic partner, someone like me, someone like Cathy, who brings different kind of wisdom from university experiences, to really create the conditions for that scholar to want to engage in community, want to do community engaged research as they graduate from their education. And then we have the agency internships. They're 3, 6, or 12 months, and they're paid. Our university pays the community organization to deliver or to give that funding to the scholar. So and these are quite lucrative. They're competitive salaries that graduate students or postdoctoral fellows would receive elsewhere for work in community organizations. And then the early career researcher teaching releases here again, and scholars can apply for one course release and renewable. I've talked about AVA Online. One of the neat things about AVA Online is anyone can take part in AVA Online. You don't have to apply, except for to apply to become an AVA member, which is pretty easy. You just go on the website and sign up, and then you can access all the resources of AVA Online. And interestingly enough, we have partnered with a number of other, I think it's around 10 other health research training platforms and other CIHR funded groups across the country. And all of our work, all of our webinars and like this are housed on the RISE website, AVA Online, and not just AVA materials can be accessed on there, but all the other materials. So it's really a treasure trove. I think I've spoken enough about the other 2, 5, and 6. So we'll just go on to the next slide, slide 13. All right, so let's talk about what the Women's and Girls Health Hub does, which is a little different than the Health Research Training Platform. But you know, the ambitions are certainly synergistic. So our new ambitions are to convene regional and national knowledge mobilization meetings in both official languages. And you probably received a mark your calendar. You're part of AVA already. You've received a mark your calendar notice for June 19th, where we're going to have a national meeting. And one of the other things we need to do is create and share a meta inventory of evidence-based programs and interventions for girls, women, and gender diverse people across the country. And we're in the process of doing that now. We're doing it Alberta, BC, the prairies, and we'll be reaching out to the Atlantic partners quite soon to find out what are the most promising or thought to be effective programs in your region. And we just want to catalog all of those and put them on our AVA website, so that, for example, an agency in Manitoba, they want to develop a program for some particular topic, say trans girls who are at risk of violence, they can go on our site, find other programs like that are being delivered across the country, maybe in your region, and then you can learn from each other without having to reinvent the wheel. And by doing those sorts of things, we think this would foster scale up of newly generated and existing knowledge and models of practice that are thought to be effective. So really trying to share a lot of what's effective across the country with each other. And how are we going to do this? Well, we're engaging in these community-based priority setting activities that are regional and national meetings. And I think we're doing some of that today. We'll be doing some of that as well in June. I spoke about the Indigenous Women's and Girls Health Hub that's doing their own work. We're having this annual national meeting. We also have bi-monthly community practice meetings, and they take a lot of different forms. The biggest group that's doing that right now is the mentees, the scholars that are taking part in the Triadic Mentorship Program. They've created their own community practice meetings, and they're meeting every month now. And then ongoing engagement around strategic planning, which will happen again in June. And I mentioned about the meta inventory, but one of the things I didn't mention is that we're also going to be grading their evidence on the effectiveness of programs that exist. And sometimes that, if there is no evidence, that'll give us guidance for what needs to be evaluated. And if there is evidence, that gives us information to, support the scale and spread of effective programs across the country. So let's go on to 14. All right, so what we're hoping the impacts of, going to the next slide. Yeah, we're hoping the impacts of AVA, the AVA Hub will have on the health of women and gender diverse people, is we're really hoping that the work that we would do by sharing information, by meeting, by building on the effectiveness of the AVA health research training platform, we're really trying to advance more equitable, evidence-based, gender-sensitive, and culturally safe holistic healthcare for women across the country. And one of the things that the AVA Health Hub does, and also the HRTP in fact does, is we really are trying to make sure that a diversity of perspectives and lived experiences are brought to bear on the work that we do and that are represented on our team. And I think I spoke a bit about that when we looked at the org chart. But by doing this work, we're really hoping that the quality of care that's provided to these groups is expanded across all sorts of diverse representations of girls and gender diverse people across the country. And then let's look at the next slide, the Alliance Center roles. So the Alliance Center roles, like Cathy, as a director of the Muriel McQueen Fergusson Center, and others who are partners across the country are co-principal applicants. So the 7 sister centers that were created after the Cole Polytechnique tragedy, massacre, 30 years ago, they were set up in response to that terrible incident, and done amazing work over the intervening 30 years. And I think I'm very grateful to the Alliance Centers for providing this amazing foundation for what AVA is trying to do, to be synergistic with what the centers are continuing to do. So the Alliance of Canadian Research Centers, which represents Western Center for Research and Education on Violence Against Women and Girls, the Muriel McQueen Fergusson Center, the Frida Center at UBC, and there's 3 Resolve centers, one in Alberta, one in Saskatchewan, and one in Manitoba. And finally, RAVE, Research Appliqué Interdisciplinaire sur les Violences, at University of Laval, are our sister centers, and the leaders of those centers are our co-principal applicants. And what we're really hoping, and it's been happening quite well, so we thank you for that, Cathy and others who might watch this video later from the other centers. We're really counting on the leaders of those centers to do mentorship as part of the AVA Health Research Training Platform. It's quite a manageable role. I'm mentoring a number of people, and it's quite a positive experience, really. I'm enjoying it a lot. And other involvement with the core leadership team. So, we share information what we're doing, and really try to get the assent or input so we can make changes from the center leaders before we really get moving too far on things. And today's meeting is a big part of that, sharing what we're doing, and it's an opportunity to provide some input to us and make sure we're on the right path here. And so let's go on to the next slide. So the Atlantic partners, it's like every other partners, but Atlantic partners are maybe most near and dear to my heart because of my connections there. But one of the things I'm really proud to be able to do is offer access to AVA programs, not just to those that are involved now, but those that can continue to be involved or join. AVA is continuing to grow, and I think that's a big part of what we want to do. So how do you get more involved is to just go on our AVA training. It's AVA training.ca website, and you can join AVA and take advantage of all the opportunities that we have there that I've alluded to already. And then our next steps are to build out our research, not just capacity, but research projects, because I think, as the puzzle on the right might suggest, we have done it. We are doing a nice job of doing training. On the bottom, you see the word engagement. And so that's the hub. The training is the health research training platform. So once we have this foundation of training and engagement modalities established across the country, the next thing we need to be doing is research and getting funding for research. So I have just applied to CIHR for for more AVA funding, but for 6 agencies across the country to evaluate and improve potentially what they're doing. And this is the next steps for AVA, is to leverage and truly, capitalize on the opportunity we have for this training and engagement work that we've been doing at AVA to actually support our academic partners and community agencies across the country to do research, implementation science research in particular, but it could be other things as well, all designed to improve the lives of girls, women, and gender diverse people affected by a risk of violence and adversity. So one of the things I hope we talk about here is what might be your research priorities in your region, because I can certainly support academics to develop applications for funding to CIHR and so on, where we could really leverage the opportunity we have here at AVA. And I just wanted to flag again our national meeting on June 19th, where we'll be talking more about research priorities in the region and the country. So just really one more slide and then we'll stop. But thought folks might be interested in finding out how to access all the application materials for the various programs. And so there's links here. These are live links in the slide deck that you can access. And particularly AVA Online, I think I really urge you to check that out because it's not competitive. The Triadic Mentorship program would not be considered competitive, but it's a matter of trying to find a good match between a scholar and a community agency that share similar interests. For the community agency internship programs, there's ongoing intake for that. So if you're looking to do something innovative, or agencies, or there's people on this call here that are representing agencies that could benefit from having a graduate student or postdoctoral fellow do something in their organization that's not paid for by them, but by us, you can check that out. It's ongoing intake, and it's similar to the Triadic Mentorship program in the sense that it's not actually competitive. It's just we're trying to find good matches. AVA Online, and you can access at any time. The early career research or teaching release, I would say, is competitive, but so far the competition hasn't been. We've had enough funding to pay for everyone we've been receiving applications from. So these are great opportunities to build out all kinds of capacity and take advantage of learning opportunities. So and just turning to the very last slide here, and I guess I will stop. I just wanted to. There we go. I see. There we go. So I just wanted to put the QR code up there where you can, another place you can access information about AVA on our website. You can see the new logo that our Indigenous scholars have agreed to for their own parallel hub work. And working together to make things better is AVA's tagline, and we're really trying to live that. So I'm happy to take any questions that you have now or even anytime. Our team is very open to being approached to try and help people get the best use of what we've been developing here. So that's it from me, Cathy.
Great. Thank you very much, Nicole. That was a very thorough overview of all of the work that's been done and all of the different offerings and opportunities that exist through AVA, especially for training and mentorship and working together with community agencies. So yeah, we're going to open up the floor now to any questions that you might have specifically about what Nicole has been explaining, that the opportunities available through AVA for training and mentorship and fostering sort of collaboration with community agencies, and as well implementation science, sort of the approach. Maybe to begin with, Nicole, you could talk a little bit about implementation science. I know that when I first heard about that, I didn't know what it was. So can you explain a little bit what you mean by that?
Yeah, great question. Well, implementation science is an emerging field of study where it really is about supporting the most effective implementation of programs. And programs it's broadly defined. So it could be an innovation, an intervention program. It could be some kind of solution. It could be, anything from an app to an in-service sort of delivery of a program. So it's quite wide ranging what we mean by that. People used to talk about intervention. Intervention is one of the types, and that has a bit of a sometimes negative connotation. So people talk about a whole variety of programs. But if you take away the negative connotation of intervention, I think that might be the easiest way to understand it. When agencies or people or healthcare providers, social services providers are intervening to promote some kind of health outcome or treat some kind of problem, that's the target. That's the thing that the implementation science is trying to improve. So the delivery of that, the uptake of that. So, for example, some typical approaches are the ones that I just used in the grant that we just applied for. And essentially, we've identified 6 community organizations across the country that are delivering programs. For example, counseling. Another one is an app. So you get a sense of the range. They're delivering programs that are designed to support the health of girls or women or gender diverse people affected by or at risk of violence and adversity. And the first phase that we will be using is to actually interview the service providers and the recipients of the programs to find out what are the challenges to delivery, what are the challenges to having the program be the most effective. So that's the first phase. And then the second phase is work with the community organizations to develop solutions, strategies to improve the delivery of those programs and services and apps and so on. And then we will be implementing the strategy that's going to augment the effectiveness of that intervention program, and then evaluate the effectiveness of that strategy. So the terms get a little, that's why I have to kind of stop and define what I mean by terms, because sometimes people just think of it as evaluation, but it is not really. It's actually part of it is evaluation, but the evaluation is for a purpose, which is to improve the implementation of the solution. And we have so many great programs that are being delivered all across the country, but sometimes they're just not, they're not accessing the population we want, or they're not having the impacts that we want. So how do we work with people who know to improve the effectiveness of those programs? And that's what implementation is all about. Yeah.
Great, thanks, Nicole. So I'll open it up. So Nadia, thanks for your comment about the explanation of implementation science. I know I always appreciate learning more about that, but any questions from folks that are online with us, you can either put it in the chat, or you can open up your mic and ask it. Or I think you can also raise your hand under reactions. There's that little hand if you'd like to ask a question of Nicole.
And I have a question for you, Cathy, and your
Sure.
team there, maybe even if people aren't jumping in with questions for me. But in the spirit of trying to be supportive of addressing the needs in your region, because that's what AVA would like to do, is figure out. And one thing I didn't mention is the CIHR. They're creating a national coordinating center for all these hubs, and they have told us these hubs like my own to find out what are the regional priorities around girls and women's health. And of course, in our project, it's girls, women's health, where there's been a risk or there's been violence. They want to know from us. They want us to ask you in your region, what are the research priorities in that area? And then we're going to be asked to feed that back to the federal government so that they in turn can make decisions about where funding goes for research and programs, I would think too. So what might be the research priorities in your region that would improve the lives of girls, women, and gender diverse people affected by violence and adversity? What research could be done to help?
That's a great question, Nicole, and something that we're always, trying to help collect that kind of information from the researchers associated with the Muriel McQueen Fergusson Center. But I'm not sure in terms of relationship to women's and girls' health. That's a new conversation that we're hoping to start today. So in addition to, identifying what folks' training needs are, yeah, what are the research priorities for the region? I know that I have heard from domestic violence service providers, particularly shelter workers, is because there was a large turnover in staff through COVID, there is a sort of a new cohort of shelter workers that are in need of training. And I've been kind of promoting the AVA online resources for that kind of training. I don't know if there's specific needs that the folks online want to identify in terms of what you're looking for in terms of training.
That is good to hear that AVA, you're promoting AVA online. And one of the things that we can do as well is if people identify gaps, they'd like to know this or like to know that, they can actually send us a note and we can try and find resources to address that need. We want AVA online to be responsive to and address the needs of people in the community. So yeah, that's a good point. And as far as our hub goes, we are tasked with figuring out what are the research priorities around women's and girls' health when they're affected by violence and adversity. So there'll be other groups looking at cardiovascular health or whatever. Right. We are the one that's looking at violence and adversity affecting girls and women and gender diverse people. So we really are hoping to get a lot of great ideas that we can share with the federal government so that we can address those problems, right? So
Yeah. So I see a couple of comments in the chat there. So Jennifer Collins wrote that Labrador has been identified as an area that needs resources for women experiencing violence. And certainly that's something that we're hearing across the country, that there is a lack of resources, essentially funding for people who can provide evidence-based responses and programming for women who have experienced violence. And yeah, and especially in remote areas like in the Atlantic provinces. Nicole, do you want to respond to that?
yeah, there must be shelters in Labrador. Are there shelters in Labrador? It'd be great to be connected with some people that are working there to maybe even take a deeper dive into this. Does anyone know? Shelters in Labrador. Or that someone, even a contact with someone who is working, it could be in a social services capacity or something if there's no shelters. It'd be great to. Oh, okay, Jennifer's trying to
Just trying to turn her mic on.
Yeah. You can type away too, Jennifer, or reach out to me after, actually, because we would love to make connections in Labrador and try to find out how we could help.
Yeah.
Absolutely.
Great.
And the comment from Sarah about women at the nexus of substance use and violence, I think that is something we're hearing about here as well in Alberta. That is causing a lot of challenges for service providers. You know, they're trying to do everything they can to get people into shelter, but the substance abuse causes a lot of challenges, either in shelter or even, I've heard, for example, in Alberta, or at least in Calgary, there's a strategy where everybody gets shelter right away, even if it means going to a hotel. Like they will put people in hotels if they can't find space at the shelters, but the hotels that they have arrangements with are really uncomfortable with people that have substance abuse problems. You know, they just, so we've got to figure out how to manage this. Yeah, I'm hearing that as well. So these are very interesting ideas and things that we can take back to our AVA online group too, because we could be identifying people across the country who might have some experience. You know, we might not have any research in these areas if they're just newly emerging. And that's one of the things that the CIHR wants to know about. So I'm already hearing the substance use and violence kind of intersection we need research on to figure out how to manage people in those situations best. But anyway, we can share what we know with building on the expertise that we have just from experience before research is done. That's one of the neat things that AVA can do. And what we're trying to do is really be this clearinghouse people can go to find out what they need in this area, right?
Yeah.
And not failing to recognize all the great work that's been done across the country already. We're trying to tap into some of the stuff that's already done. And for example, the CREVAC in Ontario, they provide a ton of resources, and we have a great partnership with them because they're part of the Alliance Centers. And they've enabled us to house or link to much of their knowledge mobilization materials, because we are just another way for them to get the word out about. They develop all these programs and services and knowledge that we want to share with people, and AVA is a way to do that. And we give, of course, full credit. Like we're not taking things, we're sharing things. So that's what AVA is trying to do, is really find out what the needs are to try and address them across the country.
Great.
Oh, and I see Jennifer's written something else here.
Yeah,
Great.
so access to sane nurse examiners, so sexual assault nurse examiners in remote areas.
Yeah, which sounds like a training gap, doesn't it? Yeah.
Jennifer Parley has written that she's noticing a gap around older adults who experience domestic and intimate partner violence. And that's certainly something that we are addressing here with a pilot project looking at women midlife and older who have experienced or are living with domestic and intimate partner violence. And so Lori Weeks is leading a team in Atlantic Canada looking at a virtual intervention, because as mentioned by others, sort of the remote nature of our largely rural provinces in Atlantic Canada make it a real challenge for folks to access services if they don't live in a center, a city center. And so the remote delivery of an intervention is being piloted through a random control trial that Lori is leading. And so that's just begun. We're hopeful that we'll have some evidence soon, but that they're still looking for research participants for that trial. And so if you're at all interested in supporting that research, take a look at our social media. There's been a couple of calls for research participants, and certainly you can email me or the center for more information about that research that's ongoing.
Yeah, that sounds very interesting. Did the team develop an app or some kind of?
Currently they're just, it's going to be, they're not developing an app, but they're actually delivering devices to either local community-based agencies or people who are interested in participating in the research, so that they do have a way to access the online intervention support.
Okay, all right. So it's online support, and they're providing that conduit to get that. That's cool.
Yeah,
that's really interesting. And that's one. And then my other research, that's what we're fighting. Actually, it doesn't have to be an app per se, but just online access is really key. Yeah. So very interesting. Yeah, I'd love to know more about that. And
yeah.
one of the 6 programs that were identified for inclusion in that CIHR grant that I just applied for, and fingers crossed we get it, because it'll be like the example of what we want to do more of across the country, is testing an online resource. And it's one developed by partners at University Laval and VL Secours in Quebec City, called Resilient. I don't know if you've heard of that one, but it is for people that are survivors of violent relationships, and found to be effective. So one of the things we're working on with Genevieve Belleville and Genevieve Lassar will be hopefully will be improving the implementation of that. They're already delivering it, and they've done some preliminary evaluation. They found it to be effective, and they're scaling it. So we want to help them with the CIHR dollars that we hope to get. We want to help them to implement it better, and evaluate that to get more evidence of its effectiveness, and which will promote scale and spread. And that's one of the things, like, New Brunswick has got, and I'm just speaking about New Brunswick for a second, but it's lots of great stuff that comes out of the Atlantic, and I want to make sure that people are aware of it. Like, people probably don't know extramural care came from New Brunswick, right? That was keeping people in their homes instead of putting them in nursing homes. That innovation came from New Brunswick, and it's just a great example of things that scaled and spread out of the region. And so if there's other things like that others in the country can learn from the maritime or Atlantic example, we definitely want to share. And I suspect I'll be writing more grants. So Cathy,
you do that very well, Nicole. There's a comment from I think it's Henry, who's online, saying suggesting that we do perhaps a baseline survey to find out the needs for organizations that are that AVA is looking to work with in Atlantic Canada, and we'd welcome, that now that we've had our first kind of formal gathering of folks associated with the AVA project. We certainly will follow up with some questions so that you can let us know what your needs are in terms of training and research.
Yeah, that is a great idea. I'm glad you pointed that out. We're trying to do survey overload, because you'll be getting a survey. Because we want to survey particularly organizations in your region to find out what the effective programs are right now, right? So we'll be surveying folks about that. And I think our June 19 meeting will kind of get at some of the needs. And you're right, maybe a follow-up, or rather than a baseline, but maybe a follow-up survey to kind of crystallize some of the things we're hearing might be a good idea.
Yeah.
Yeah,
I just see Peter's confirmed that. I know we talked about it, so I'll just introduce Peter. So Peter Titus is a communications officer at the Muriel McQueen Fergusson Center. So welcome, Peter. He's just joined us, and we're very grateful for AVA funding to help fund Peter's position at the center. But Peter's been instrumental in pulling this webinar together, and will be following up with everyone who's been part of it. Jennifer has another comment. Are you recommending we reach out to organizations with information on AVA to build partnerships in our region?
Yeah, you could, Jennifer. You could definitely. We want people to connect to AVA. And if you, for example, Jennifer, I think you're an academic, right? We've spoken. And so I think that, or yeah, it's great, great. I'm just trying to, I thought so. It's great to have you here. But if, for example, you wanted to engage in triadic mentorship with a community organization where you would mentor a scholar, you know, graduate student or a postdoctoral fellow, or you wanted to engage in that yourself, um, or you wanted to support a community organization to improve or evaluate or do something in that community organization with the help of a scholar, you could, that actually could be tying into something that you're already doing with them. We're doing that a lot. So it's, you know, the academic doesn't need to be involved with the internship, but I think it can be very helpful. I know Matt Rogers is doing something like that. It's a with Matt Rogers is at UNB, and he is working with a scholar doing a community agency internship, and he is very engaged in the internship because it aligns with his interests well. So that's the kind of thing that you can be doing. If you want some, we could even have you know, we could set up a meeting, Jennifer, if you want some ideas about how you might do that or how we could help you do that. And so we could talk more.
Yeah, and the funding for scholars to be engaged with community-based organizations through internships, I think is a real opportunity, as you were saying, because that's you know, funding provided by you for the organization. And I know that at least here in New Brunswick, we've had undergraduate internships that used to be funded by the provincial government. The provincial government has pulled back some of that funding, and so knowing that there is you know, your funding out there for graduate students, I think would be welcome by many of the organizations, at least that we've been working with.
And by the way, Cathy, I mean, I wouldn't promote this too widely, but we have also supported undergraduate students. So if you've got really great, you know, we're trying to be flexible and meet agencies' needs. So there's a great student who's interested in doing something with an organization, that organization sees a need for that student to do something that helps them. We're open to that. Our primary focus has been on graduate students and postdoctoral fellows, but we, like I said, we're trying to meet people where they are and agencies where they are and meet their needs. So maybe this could help fill a gap. And I don't know, I don't think we have any internships in the Maritimes or Atlantic yet. I don't think we do. And Carrie unfortunately is not on the call and she would know.
No,
But
I didn't see any in the list
yeah,
that you posted just
yeah.
recently.
And
That's
we
why
want
I'm
that.
happy to be promoting that, because it'd be great if
Yeah.
we could get some established.
People are loving it. And we're even to the point where organizations are saying, yeah, we've had, you know, they have 3 interns and they want extensions, and we'd love to give them to them. But we want to make sure that that funding that we have is equitably distributed across the country, and don't want to leave out anybody. And I would love to see it and the intake is any time. So there's no like next round. All people have to do is talk to a community organization that you think could benefit from some help. So that's what it is. It's meant to give the student an outstanding experience in a real world
Yeah.
setting that's going to meet the needs of the community agency. So that's what it's about. And so if agencies need some help, we can give them funding. We have provided up to $30,000 to community organizations so far. We're thinking we might need to cap it until we can get more, you know, we want to make sure that all organizations across the country have an opportunity, but that's a lot of money to be giving out. And I want to make sure that the Atlantic has an opportunity to take advantage of that.
That's great.
And in June, actually, we're hoping to have those scholars speak about the projects that they did in those organizations. So maybe that'll give people a better sense about things that could be possible.
Okay, there was another question from Henry, who's on his iPhone. What if it is a group of women, for example, Ugandan women in Calgary, who are forcing domestic violence? How can AVA help?
I don't know what forcing means, Henry. What does that mean?
Supposed to be facing, sorry, it's a typo.
Well, supposed to be what, sorry?
Facing.
Facing. Oh, how can
Yeah.
AVA help? Well, just connect us, connect us to the organization, and we can do what we can to support those organizations. Yeah, that would be completely appropriate. Yeah. We're already working with Ruth's House, which is a shelter that's serving Black and racialized people in Calgary, and they actually have benefited from internships and AVA online training and so on. So absolutely, we want to get the word out. If you could help us connect, we'll do the follow-up. Henry, thanks a lot. And thanks for joining the call.
You're welcome, Nicole.
Great.
Yeah, and I know, Nicole, too, there's a movement among graduate programs in universities across the country for more experiential learning opportunities for graduate students, because most graduate students will go on to careers in the community sector, right? Or, in government, as
Yeah.
opposed to in academia. And so we're really looking to get students some very practical experiential learning as part of their graduate studies. So this is a great, great opportunity.
Yeah, that's exactly what we're responding to, is that reality. And we really want to create comfort and capacity in community agencies and people that have got, training, graduate degrees, to do research together to improve the evidence that we have in support of programs and services, improve our programs and services so we deliver better quality programs to help people more effectively. So yeah, that's what we're trying to do.
So, Nicole, you mentioned that, it's easy to get access to the AVA online training. So what does one have to do to get, AVA membership? What's that involved?
We just go to the AVA. Maybe Kelly could speak to this. I don't know, but you could chime in, Kelly, if I'm missing something. But it should be pretty straightforward because we've tested it a lot. But you should just be able to go to the avatraining.ca website and go to the tab that speaks to membership and just fill in a couple of things and you're in. Carrie does review, our program manager for AVA. She does review applications and make sure they're complete and so on, and she'll follow up.
Great. And can you give us an idea of what some of the topics are for the courses that are available online?
Yeah, well, there's a ton of courses, of course, on gender-based violence. There's a lot, and there's a stream to do with adults exposure and children's exposure. It's introductory, or we call it foundational, intermediate, and advanced level courses in each area. And you can get badges as you go through and complete certain number of hours in the courses. I probably should have added a slide about AVA Online, and we'll maybe do that when we do this presentation again in June. But so there's a ton of content addressing, all kinds of, so many things, basically, what does it look like? What are the impacts? How do you help? What are the things that can help? And then we have courses to do with implementation science, which we think will be really important for people working in community and in universities to have a sense of how they can improve services and supports for people. So there's a lot, and the training there, all the training is done, like, for example, Kendra Nixon, who runs Resolve in the Prairies, she does the introductory or foundational course for gender-based violence along with me. And then Ian Graham, who is the implementation science, expert, literally wrote the books on it and is considered the world expert. He's done our implementation science courses. And then another one of the 4 streams is to do with how early exposures to violence and adversity impact brain and health. So we have a program there called gosh, it's escaping me at the moment. I can't even believe it. Anyway, there's a program there all around the neuroscience of development and how early exposures just put people on these risk trajectories. So there's a course around that. And then there's the EDIA stream as well. So, but for us, really, I think it's mostly around gender-based violence affecting girls and women, and implementation science and the neuroscience stuff will be the key courses. And there's a lot of courses, and it's growing all the time.
And they're all free, right?
Oh yeah, they're all free. Yeah, in fact, some of them aren't free, but we're paying for them. So the equity, diversity, and inclusion training, we do it with the Canadian Centre on Diversity and Inclusion, and we have licenses for everyone to do their training. So many organizations are paying for that. And if you need that in your organization, you can go to AVA and do it for free. Okay.
Great, thanks.
Oh, and I just, it's the core story of brain development is the course on the neuroscience. I couldn't think of the name of the course, but it's all about, it uses a lot of metaphors to explain the neuroscience, which underpins how we understand that violence negatively impacts development. So. Anyway, check it out. If you have any questions or if you see gaps, we're also really keen to address gaps in our curriculum, and it's growing and growing.
Great. Are there any other questions or comments in terms of what folks need in terms of training? It's great that so many people were able to come to today's session. Really like to be able to spread this information far and wide. And you know, you've been there are a lot of links in the chat for folks to access you know, how to get an AVA membership, or how to you know, to see some of those courses that Nicole was just talking about. Really, the AVA website is a treasure trove of information. And you can also, if you click, I think, on partnerships, you can see who the partners are in your region. And so if you're not connected yet, but you'd like to get connected, you can obviously contact us here at the MMFC, or the AVA principal team, or you know, you can get in touch with somebody who's a little closer to your home.
Okay, great. Well, thanks for the chance to speak about this today. And we'll see you in
Great.
June. We'll talk more.
Okay,
Maybe
thanks
just
so
kind of
much.
planted some seeds.
Yeah, thanks so much, Nicole, and thanks, Peter, for all your work, and everybody over at AVA for putting this together. Have a great afternoon, everyone.
Yeah, thanks. You too.